What does informed consent for risperidone, otherwise known as risperidone, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. And I'm going through a series where each day I go through one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And today we're going to be talking about risperidone or risperidone. And this is one of our most commonly prescribed antipsychotics. It is an atypical antipsychotic, and it's primarily used to treat psychosis, so schizophrenia, schizoaffective disorder, but you're definitely also going to see this used in bipolar disorder. It's not FDA approved for mood stabilization, but it's often used for this purpose. It's sometimes used off-label for tic disorder, as well as for things like OCD. It is FDA approved for autism, for the management of behavioral issues and agitation. It can be a really good one because there are multiple different long-acting injectable versions, which you can take anywhere from as frequently as 2 weeks to as infrequently as once every 3 months. And so that makes it a really good option for people who have trouble taking a medication every day or just don't want to. So risperidone, in contrast to the other atypical antipsychotics, is the most like atypical antipsychotic, meaning that it has a much stronger D2 blockade, and it's generally dosed from 1 or even half a milligram a day up to 8 is the maximum dosage that you might have. And at the 8 milligrams a day, it's really acting as haloperidol, which is one of our typical antipsychotics. So let's jump into the potential side effects. So potential side effects I think about in 3 clusters. First is going to be the extrapyramidal symptoms. So these are those things caused by the D2 blockade. These can be movement disorders like tremor, uncontrolled muscle contractions, tardive dyskinesia, where you're having uncontrolled movements of the mouth or the eyes, dystonias, which are an uncontrolled and sustained reaction, like torticollis is the uncontrolled contraction of your neck muscle. There's also Parkinsonian symptoms like slowed gait, muscle rigidity, tremor, masked faces, and there's the risk of neuroleptic malignant syndrome. So these symptoms, although they're less than with the typicals, as you get higher in the dose with the risperidone, they become more likely. So you may often see an additional medication like benztropine or diphenhydramine, otherwise known as Benadryl, to address these types of side effects. The second cluster of medications is going to be basically those that can occur with any psychotropic medication. So things like headache, dizziness, fatigue. It usually causes sedation, but I have had cases where it causes insomnia, dry mouth, dry eye, restless leg syndrome. So any of those things can certainly happen. And the last cluster of symptoms that I think about are the metabolic side effects. So this is going to be things like increase in appetite, weight gain, blood sugar issues, cholesterol issues. So risperidone is not the worst offender of these things, but it's definitely a risk when you're taking this medication. There are a few things I think of as particularly unique to risperidone, and those include the potential effects on your prolactin levels. It's not that none of the other antipsychotics could affect prolactin, but the risperidone is definitely the worst offender. So what this can look like if you have elevated prolactin levels is having sexual dysfunction, like decreased libido, difficulty achieving orgasm, difficulty sustaining an erection. It can also cause menstrual irregularities in women or lactation, and it can cause gynecomastia, or the growth of breast tissue in men. So if you're having any of these symptoms, make sure that your provider is checking your prolactin level. In addition to checking the prolactin level, you're going to have your routine annual screening labs of a comprehensive metabolic panel, a complete blood count, your blood sugar, and your cholesterol. And similar to most other antipsychotics and antidepressants, it can be difficult to get off of this medication. We know that if you stop it abruptly, you're increasing your chances of withdrawal symptoms and recurrence of illness. So if you're considering getting off, it's important to work with your prescriber to do so safely. So after going through all of this and answering any questions that my patient might have, we would go forward with determining a treatment plan that made sense for them. If there are any other medications that you want to hear the informed consent process for, then put them in the comments below. I'm also putting together an email list for anyone who's interested in my content, because I may be offering future courses or resources that I want to be able to share with you all directly. So if that's you, then send me a DM with your email, and I promise I won't spam you. Wishing you all good mental health today, and I'll see you in the next one.